INTEGRIS is the newest member of the Mayo Clinic Care Network. The collaboration allows INTEGRIS physicians to work directly with Mayo Clinic physicians on complex diagnosis and treatment plans to ensure Oklahoma patients have access to the latest medical knowledge available. You see, this will allow patients to receive the care they need close to home without additional cost or unnecessary travel. Here to tell us more about the newly formed relationship and how it will improve the health of our community, we have Bruce Lawrence, President and CEO of INTEGRIS, and Dr. David Hayes, Medical Director with the Mayo Clinic Care Center. Gentlemen, congratulations and thank you for your time today.
Thank you.
Thank you. We appreciate it.
We were looking at some footage from your announcement this morning. You had a packed house. How'd it go?
It went very well. We were at the INTEGRIS Baptist Medical Center on the main campus there, and we did have a packed house in the cafeteria this morning. There was a lot of energy and a lot of excitement.
Well, Doctor, what is the Mayo Clinic Care Network?
The Mayo Clinic Care Network is an approach that the Mayo Clinic started about 5 years ago as a way to form relationships with other organizations around the country that are culturally and philosophically similar to us, which really means that they're really focused on patient-centered care. We think it's important that patients receive as much care locally as possible, and if we can extend Mayo Clinic knowledge and expertise to these highly qualified, high-quality, high-safety organizations, we think it's a win for both organizations.
So I'm sure you did your due diligence and you've spent some time in Oklahoma working on this. Why did you choose INTEGRIS?
We chose INTEGRIS, or I've had a number of conversations over the past year, have really gotten to know the administrative and physician leadership team. There were some acquaintances between organizations even before that, so we had an inside look, if you will, into INTEGRIS business. We've gone through this deep due diligence process. It was clear that INTEGRIS was everything that we thought it would be. Very high quality, high safety, services are excellent, and very similar to our culture.
Bruce, we'll throw it to you. Why is INTEGRIS collaborating with the Mayo Clinic?
You know, we're in a point, as quickly as medicine's changing, as quickly as the technology changes, as quickly as the research changes, we felt like that we could benefit, and our patients would benefit from having a collaboration with an organization like Mayo. And as Dr. Hayes said, you know, we had some relationships and we started talking a couple of years ago, and then in earnest about a year ago, we developed a team working collaboratively with the Mayo team to see what would this look like or what could it look like. At the end of the day, this will benefit our patients in Oklahoma.
Let's talk about that a little bit. How, from the patient side of things, do they see the benefit?
Well, they will see the benefit because their physician will be able to access a colleague at Mayo if they have a question about the medical care or the treatment protocols that their particular patient is on. And more than anything else, that patient will have access to Mayo's expertise and not have to leave Oklahoma. We think that's a tremendous savings.
That has to be a huge thing. If in the past you would have to go to Houston or another, that could be very disruptive to the family.
Right.
Additional costs of travel, leaving work or whatever. But this provides, they stay local.
This will help to provide that. Now, there may still be an occasion,
Sure.
We think it'd be very rare, where a patient would need to go to another center for a higher level of care, but this will give a lot of comfort to Oklahomans that they can have, you know, the expertise of a Mayo Clinic right here in Oklahoma.
So how does this affect the cost of health care?
Well, I think the unique thing about this is it's not going to cost the patient anything for this. This is something that INTEGRIS is doing as an investment. Like we've done for many times over the years across Oklahoma. We've invested in order to improve the health of the people and the communities that we serve. That's our mission. That's why we exist. And by having this relationship with Mayo, we'll be able to extend, again, their expertise to our local providers, and the patient will never receive a bill for that.
Timeline-wise, at what point is this rolled out? Is it started immediately, or?
Well, we rolled it out today, and it started today. So we're ready to go. In fact, there are already physicians who we've talked with in the past 24 hours who are already lining up to access some of their colleagues at the Mayo Clinic.
It's a network. You've been doing this, as you mentioned, for over the past few years. How does Mayo and INTEGRIS physicians, how do they communicate and work together? How does it work behind the scenes?
Number of ways. For one thing, for the electronic consults, when the physician wants to have a consultation done at the Mayo Clinic, everything's uploaded electronically, it's secure, it's triaged to the right Mayo Clinic subspecialist, consultation done and sent back. Everything electronic, and it's all physician to physician. But there may also be contact through some sharing of best practices, through something called electronic tumor boards for complex cancer patients. So it could end up being a number of ways, but we really do want to grow that physician to physician engagement.
Business-wise, people might say, is this a merger? Are we looking at Mayo buying INTEGRIS or anything to that?
Yeah, that's a great question. This is not a merger. It's not an acquisition. Mayo is a very strong organization. INTEGRIS is a very strong organization. Operationally, there's no coming together there. This is truly a clinical collaboration. It's taking the ability to leverage the expertise, the scientists, the physicians, the other clinicians, the world-breaking medicine at the Mayo Clinic and having it available in Oklahoma.
One last question for you, and this may be another question that citizens and residents might have. How are the facilities affected? And what INTEGRIS facilities will be affected? Is this across the board?
This will be available through all of our INTEGRIS physicians across the state of Oklahoma, yes.
Very good. Bruce Lawrence and Dr. David Hayes, Medical Director of the Mayo Clinic Care Network. Gentlemen, congratulations. Thank you for your time this afternoon, and best of luck moving forward.
Okay. Thank you. Appreciate it.